Hi, this is Jared Moss with Regional Urology. Today we're going to be talking about a vasectomy. About 500,000 men every year choose to undergo a vasectomy. It's a great option for men that are considering permanent sterilization. Vasectomies are potentially reversible, but we do ask patients to view this as a permanent decision, as vasectomy reversals are not guaranteed. They're typically not covered by insurance, so this really needs to be viewed as a permanent decision. So in this section, we'll talk about what is a vasectomy. It's a very minor office-based procedure. I typically tell the guys that you'll come in, it takes about 10 to 15 minutes to perform a vasectomy. We will do it in a procedure room, very similar to the room that you're being seen in if you're being visited in the office. We usually will either give you some medicines before you come in or give you some medicines when you arrive to help you get nice and relaxed. I tell my guys, as long as you're relaxed, ultimately it makes it easier for me. If it's easier for me, it's going to be safer for you. We give you some numbing medicine into the skin of the scrotum. We're nowhere near the testicle or anything like that. It's just into the skin of the scrotum, and it's going to help numb the area up. This burns for approximately 20 to 30 seconds. After the numbing medicine is in, you should be very, very comfortable. We typically have music going. We try to keep it very lighthearted. Very small incision is made in the scrotum, closed with one absorbable stitch. Permanent titanium clips are applied to each side. A small segment of the vas deferens is divided and clamped. After the procedure, the patient is able to go home. We ask that you alternate ice packs for usually about 24 hours, 30 minutes on, 30 minutes off. We give you some anti-inflammatories and some narcotic pain medicine. Typically, most men are not going to require narcotic pain medicine, but we want you to have some just in case you're having some pain. Another question you might have is, what are the risks of a vasectomy? So vasectomy is a very, very safe procedure. It's extremely rare that anybody has a complication from this. Risk of the two ends growing back together is 1 in 2,000. The only thing more certain than that is for a female to have a hysterectomy for reproductive purposes, which would be very much on the overkill side of things. It does have a higher success rate than a tubal ligation, and it's also lower risk. Other potential problems that could result from a vasectomy or a blood collection in the scrotum that would require surgical drainage. It's extremely rare, less than 1% of the time. An infection is theoretically possible, although it's very, very rare in young, healthy men. Pain that's long-lasting in the testicles is extremely rare. So by and large, it is a very safe procedure. And it's important to realize that once you've healed up from a vasectomy, everything works exactly the same. Testosterone, erection, sensation, ejaculation. Once you've healed up, you shouldn't even know that you've had a vasectomy. So that's very important for men to realize that nobody would sign up for this procedure if anything changed in that area. I do ask my men to clean the area up before they come in. You do not need a straight razor. Clippers are fine. If you're uncomfortable doing that, we can certainly take care of it at the time of procedure. But I ask that you use clippers to clean up the pubic hair area around the penis and the scrotum. It's also important to remember that you're not supposed to have unprotected sex until you have 2 negative semen specimens. We will give you the cups, we'll give you the collection kit on the day of the vasectomy. We'll go over all of the instructions with you at that time. It's very, very convenient for patients to arrange this, make a phone call, drop this off when it's convenient. You don't need any additional doctor visits or anything like that. It's just a simple drop it off in a paper bag and somebody will call you and let you know when things are in the clear. Typically it takes men 8 to 10 weeks to clear. So if you know someone who says, well, I had a vasectomy and then my wife got pregnant afterwards, typically that's somebody that did not go back and verify that they had cleared all of the sperm and they started having unprotected sex too soon. Most of the time, if you have a vasectomy on a Friday, typically you can go back to work on a Monday. I usually advise people no heavy lifting for at least 1 week, and then you can ease back into activities. It's fine for you to shower. We just ask that you don't have any soaking in the tubs. There is an absorbable stitch, and that will fall out on its own. We don't ask that you come back for a follow-up visit, but of course, if you're having any problems, if you have questions, we're always happy to see you back as needed just to do a checkup, make sure that everything looks okay. It is important to remember that if you're going to be receiving prescription for medicines today, that you go ahead and get those prescriptions filled within a week. Put those medicines into your medicine cabinet, keep it away from where children can get into it. We may provide you a medicine to help with anxiety as well as a pain tablet. We do ask that you take these approximately 1 hour before your scheduled vasectomy time, and then of course you'll need someone to drive you to the appointment. But if you don't go ahead and get those prescriptions filled, since they are controlled substances, they will void the prescriptions fairly soon. So if, as a general rule of thumb, if you get those filled within a week and put them up in the cabinet until it's time for your vasectomy, you should be good to go. Another common question that people have is a vasectomy covered by my insurance? The short answer is most of the time it is covered by your insurance. Today we're not going to know exactly what that cost will be to you. It's dependent upon the deductible that you selected when you purchased your insurance. It depends on where you are in your deductible, how close you've come to meeting your deductible. So there's a lot of factors in that. Ultimately, we will get you an answer as far as what that cost will be. Is it going to be covered by your insurance before we ever proceed with a vasectomy, so that there will not be any surprises. It's also important to note that regarding scheduling, we won't have any specific answers for you today as far as what specific days that I have available to do it. Typically, if you're willing to do it earlier in the week, you can get the vasectomy done sooner. Patients that are really adamant about having it done on a Friday, there could be several weeks, but it's pretty rare that we're not able to work around your schedule. Our scheduling person will likely be contacting you within a week or so of your visit today to work with you on selecting a date that's going to be good for you. I hope that you found this video helpful. It's just important to review that a vasectomy is not the only reproductive option as far as sterilization. There are condoms, other forms of birth control. There are tubal ligations for women, but a vasectomy has a higher success rate in men and it's lower risk. We talked about the fact it's a quick 10 to 15 minute procedure. It's important to remember not to have unprotected sex until you get 2 negative semen specimens. If you have any further questions, please let us know. This information is posted on our website, regionalurology.com, and the telephone number is 318-683-0411. Thanks.